strain it's put on nurses and other healthcare professionals is enormous, of course. How well prepared do you think your colleagues were for what was coming at them into hospitals in the UK?
Well, Martine, I don't think anyone was prepared for this, as Dr. Harris has just outlined. And the sense of shock was quite profound. And I think that continues to some extent, although people have attuned to the pandemic. No one hoped that it would ever last this long. And I think the psychological consequences of this have yet to completely unfurl. And we know from research evidence that we're collecting now that nurses have some of the highest levels of burnout, distress and anxiety, even exceeding levels of the military during combat. So I think that probably says what the degree of distress actually is in our healthcare workers. And it's really very worrying indeed.
And of course, hundreds of health and care workers in the UK have died as a result of the work that they carry out. Dr. Harris, how varied in that global view that you have has the response been when you look at countries around the world and how they've reacted to a pandemic?
It's been very much varied, and I think, as I'm sure you're aware, in East Asia and in the Western Pacific, there were much earlier and stronger responses, much earlier sort of mobilization to get the testing and the tracking and the isolation and make sure that people really isolated, really followed them up. And they've had outbreaks, they've had some bad ones, but they've been able to bring the numbers down relatively quickly. And the other thing that's really been clear is where a society has had a leader that's able to galvanize the community, really bring their community with them and explain to them very clearly what's going on and really make sure everybody at every level knows what to do and what's going to happen. Those communities have been more successful as well.
Dr. Harris, how important is the culture of a society in getting people to comply, and also the willingness of politicians to be much firmer in their messaging?
Well, it's quite interesting, actually. If you look around, you can't just say it's like one culture or another. Early on, people said, oh, yeah, well, the country sort of got very sort of command-oriented systems where people do what they're told. They'll do fine, but you won't get the sort of countries where people are very individualistic. But we've seen countries like New Zealand, they're very individualistic. They've been very successful. Compared with, say, Thailand, also very successful, and Vietnam. Now, there's not really one tie, except that, again, there was an understanding that this was important. There was an understanding that what people were being asked to do needed to be done, and it was done early.
Professor Rafferty, how welcome has the focus on the work that nurses do been? Because we've all been made much more aware of the pressures that they're under, and also extremely grateful for what they do.
Yes, and I think nurses have really come into their own during this pandemic and shown what they're made of, their mettle, and really demonstrated the complexity of decision-making, the sophistication of the skill levels, and indeed the profound teamworking capabilities, because this has really brought people together as well. And doctors have been working as nurses and allied health professionals too. So I think the public, as well as patients and their loved ones and other professionals, have actually been able to see what nurses and nursing staff are actually made of. And it's really spurned a greater appreciation of nursing itself. And let's face it, at the beginning of the pandemic, and largely to an extent now, patients are really relying on the skills that nurses have to recover from COVID, because we've got relatively little in our therapeutic kit bag to really help patients.
And not least the fact that they will hold somebody's hand in their darkest moments, which no medicine can do for you. Professor Dame Anne-Marie Rafferty, President of the Royal College of Nursing, and Dr. Margaret Harris from the World Health Organization. Good to talk to both of you. Thank you very much.
Thank you.
The latest UK government figures show that another